The COVID-19 pandemic forced many of us to use telemedicine. It also highlighted physician shortages across the state. But now a new state law is helping fill the gap by allowing out-of-state doctors to practice in Texas. We partnered with our sister station in Arkansas to take a closer look at this nationwide agreement.
Texas is now part of 37 states to join the Interstate Medical Licensure Compact, which expedites medical licenses, making it easier for doctors licensed in other states to treat you here in Texas. Our doctors can now also more easily get licenses in other states in the compact.
The law went into effect in 2021, but applications weren't accepted until last year.
KXAN investigator Arzo Dos looks at this solution push to help with our healthcare shortages, but one that still has some challenges in Texas.
I'm seeing people in the comfort of their homes. They're not having to wait. They just jump onto a Zoom just like we are right now.
This is Dr. Nikki Davis. She's based in Utah but can now treat patients right here in Texas.
We have a lot of patients in Texas who are looking for this kind of medicine, these kind of doctors who are there to help walk them through making lifestyle changes to feel better, lose weight, get off medications.
She's board certified in both family and lifestyle medicine and part of the team at Plan-Based Telehealth, which started during the pandemic. What kind of things are you treating?
I would say that for the most part, it's chronic disease. And chronic disease is really disease that is from lifestyle. So poor lifestyle choices.
Davis is one of more than 1,300 doctors licensed in Texas since March of last year through the Interstate Medical Licensure Compact.
It has made it much easier for physicians to become licensed in Texas. And so it does lower the kind of regulatory burdens or hoops they may have to jump through.
The Texas Medical Board, which oversees licensing for Texas physicians, says the average days for physician licensing through the traditional process was 26 days in the most recent fiscal year. But the compact speeds up the process and licenses can be issued in 10 days or sooner. To apply, doctors have to complete an online application, confirm eligibility, select a state of principal license or home state where they hold a license to practice medicine, which must be in a participating compact state, pay an application fee, and complete mandatory fingerprinting for a national criminal background check. Doctors who qualify will then receive a letter, and they'll be able to select states where they want to get licensed. TMB says online that doctors themselves are responsible for making a self-determination of eligibility before applying.
It's kind of a primer to them is, hey, before you start down this path and pay the money to the compact and start filling out the paperwork, make sure that you meet all those requirements. We're obviously going to double check that you do.
How can you ensure that decisions are getting fully vetted if the process is expedited?
So we go back, make sure they graduated from an accredited medical school, look at their residency, where they completed their residency. Did they do the required amount of time for that postgraduate training? And then kind of the main thing we're looking at that's going to be different is going to be an updated criminal history check and also a check of make sure they didn't have any discipline from other states.
So far, TMB says it's denied 35 applicants for reasons like already having a full physician license in Texas, wanting to withdraw their application, or it was a duplicate. How do you plan to measure the success of this compact?
I think the success, a lot of it is looked at how much are people using the compact. And also, hopefully not, but in the event that there is some type of disciplinary action for someone that is a compact licensee, how smooth is that communication from us to other states and other states to us to make sure that everyone is doing what they're supposed to do as far as disciplinary action.
Any investigation would be carried out by the medical board in the state where the patient who filed the complaint lives. Any disciplinary action taken would be shared with all compact states.
Getting your license through the compact doesn't change what the standard of care is in Texas or any other state. All it is that voluntary expedited pathway to get the license. Once you get the license, you are subject to each state's individual standard of care and requirements, and to be able to maintain the license and practice in that state.
One limitation, though, doctors licensed through the compact are the only ones who can treat patients, not any other medical staff at their office, unless they too are licensed through the state. Another challenge the American Telemedicine Association sees.
Doesn't automatically mean that a physician has access to every state that, the more than 2-3 dozen states that have adopted the compact. That it's not like a universal recognition by all those other states. You still have to go through the oftentimes time-consuming process of getting a license in the individual state in question.
I added Texas as soon as I saw that it was in the compact. Texas is a big state for us. We see a lot of people through plant-based telehealth in Texas.
Dr. Davis is now licensed in 13 states. She says Texas's process is more stringent.
In Texas, they require that you take an exam. So that took a little bit extra time where I had to purchase some materials to study from, and then I had to purchase this exam to take.
This can be a costly and time-consuming process for doctors. It costs $700 to apply, plus additional fees for each state where they want to be licensed. Team B data we obtained shows doctors from these 5 states have been issued the most Texas licenses: Colorado, Illinois, Georgia, Arizona, and Washington. The top specialties are family medicine, internal medicine, emergency medicine, psychiatry, and neurology.
And Arzo, you mentioned doctors with a license can treat patients and not other staff unless they are licensed too, but what about nurses?
Well, Jen and Daniel, registered nurses and licensed vocational nurses have their own compact and only need one multi-state license. So they can practice in their home state in other compact states without having to get additional licenses.
All right, Arzo, thank you very much. And we asked the lawmaker who pushed for Texas to be a part of the physician compact and pass legislation if any changes will be made this session. We're still waiting on a response.
And as we mentioned, we partnered with our Arkansas sister station on this project as that state weighs its own options for telehealth and joining the compact. Explore the entire project by heading to KXAN.com and searching for this story in the investigative section.